How did governments respond to the Black Death in medieval times? Breaking news from history. The question on many minds is how governments reacted to the devastating Black Death in the mid-14th century. As the plague swept through Europe, authorities faced an unprecedented crisis. Viewers might be curious about how these responses shaped our understanding of public health today. Let's discuss the actions taken by governments during this dark period. During the Black Death, many European cities implemented early forms of quarantine. Ports and towns restricted travel and trade to keep infected individuals from entering. Ships arriving from affected areas often waited before docking. This practice laid the groundwork for future quarantine laws. Governments also issued regulations aimed at public health. They focused on sanitation and controlling gatherings. Streets were cleaned, waste was removed, and large assemblies were sometimes banned. However, the limited understanding of disease transmission meant these measures had mixed results. To control the plague's spread, authorities imposed travel restrictions within regions. In some cases, entire villages or households were sealed off if an infection was detected. Though harsh, these actions reflected desperate attempts to contain the epidemic. Religious institutions played a central role during this time. Governments often collaborated with them, but the high death toll among clergy complicated coordinated responses. Some rulers supported religious processions or prayers to seek divine intervention, reflecting the era's beliefs. The massive loss of life led to significant labor shortages and economic disruption. Some governments attempted to regulate wages and prices to prevent inflation and social unrest. Laws were enacted to stabilize economies and maintain feudal obligations during this crisis. The plague also triggered fear and violence against minority groups, particularly Jewish communities, who were falsely blamed for the disease. Authorities sometimes intervened to protect these groups or restore order, but responses varied widely. Overall, medieval governments responded with a mix of public health attempts, legal controls, and reliance on religious frameworks. Their limited medical knowledge and the scale of the disaster meant many measures were insufficient. However, these early efforts at epidemic management laid the foundation for future public health responses in Europe. The Black Death's impact continues to influence how societies approach health crises today.